Well, Zach was born 3 months premature, and so when he was in the NICU, they diagnosed his hypospadias right away. So we were aware from the very beginning that there was something that needed to be fixed, but we weren't sure about the severity until later.
And he went through so many medical issues at the beginning that those had to be dealt with first before we could really approach the hypospadias. And at the time, we thought that maybe that was going to be more of a minor thing, but it turned out to be something that ended up being more major with a number of operations.
Well, he had his first surgery when he was about 10 months old, and that didn't work. It broke down, meaning that the tissue that was used basically broke apart. And so when he would urinate, it would come out of the base of his penis. And so when he was a baby, that was fine, but as he got older, 3, 4, that was not going to work because he obviously wasn't urinating properly. He had a second surgery, I believe, maybe at 1.5, and that too broke down and didn't work. And at that point, we were referred to another pediatric urologist. And so around 2.5, he had a third surgery that also broke down. And at that point, the pediatric urologist said, okay, we need to have the man who is very, very familiar with this particular condition and is specialized in this area. And lucky for you, he's in your own backyard. And so that's when we were referred to Dr. Gelman.
The repairs that were attempted resulted in failures, and at each stage along the way, we kind of got more information about what was happening. And at each failure, there was a certain amount of tissue that was used that would then not be able to be used again. So I think each time the surgery was performed, it became a little bit more difficult each time to repair it.
And that tissue ended up leaving scar tissue, and in the urethra, it basically, it's a tube, and the more scar tissue or tissue that was left behind, it would constrict. And so by the time we saw Dr. Gelman, and we didn't realize the severity of it, but he was urinating at there was such a small amount of space for the urine to come through that he could have very, very easily been in a compromised position with his kidney, renal failure, that sort of thing. And when he was 4, he did the first part of a 2-part urethral reconstruction. I believe it was in June when he was 4, and he basically reconstructed the whole urethra at that time. And it was a very long surgery. Dr. Gelman was very upfront with us about what was going to happen. He spent a lot of time explaining to us what was going to happen. And he was realistic about the recovery process along with the long-term prognosis. And so at that time it was decided that after this the first stage of it, the next summer he would do the second stage, which was closing up that area, reconstructing the penis, and just basically finishing up what the first part had started.
The first doctor that tried the repair had a certain level of ability that he attempted, and then I think he realized that it wasn't something that he was going to be able to fix, and so he referred us to the next specialist. The same thing happened there. Again, I think we got good care and good attempt, but he didn't have the right skill set or process to be able to repair it fully. The things that he tried did not work. So at this point, I mean, you're feeling like the doctors are doing their best, but you're wondering, okay, is this really something that is going to be able to be repaired? Certainly with Dr. Gelman, he gave us every indication that this is something that he does regularly and that he knows what to do and he can repair it. Again, but there's no guarantees that it's going to be smooth sailing.
We feel really blessed that we lived in an area that was so close to him so that we didn't have to travel to see him, but we just were really impressed by how he would really sit with us and just explain everything. And we're the type of parents that have a lot of questions, and so he worked through those questions with us. And I believe he has children of his own, and so that compassion of this being not his typical adult patient came through as well. And every resident that we encountered just said, "You are so lucky that you have him as a doctor. He's the expert in this area." So that gave us a lot of comfort, I think.
Mm-hmm. And Dr. Gelman, exudes a passionate self towards this whole area of work that he does. He's very, very strong, very knowledgeable, extremely passionate at what he's able to do, and he's a leader in his field. So again, we're very blessed and fortunate to be able to see him for this.
He was 5 during the second stage of the repair, and he is 9 now. So 5 years has passed since the initial one, 4 since the last one, and we see Dr. Gelman every year, and everything's going well. And he's growing and he's developing, and the repair has held up the way that it should.
And the condition, the repair, it doesn't hold him back in any way. There's no restrictions that he has from being able to do anything that a typical boy of 9 years old would do. So it's a blessing.